Okay, so today I'm talking to Hunter. Hunter's based in Taiwan, and Hunter's one of the Kinetic Control accredited tutors, and also he's delivering not only on the KC program, but sort of expanding out into the movement science practitioner components as well. So, hi, Hunter.
Hello, Lincoln.
How you going?
Yeah, very good.
So, I think what would be really good is to understand, why did you get involved in physiotherapy in the first place? So, what attracted you to do that?
Well, to be honest, after I graduated from high school, I initially just wanted to study medicine. But later
Okay.
on, I couldn't meet the grade requirements, so I chose to study physical therapy, which related to sport injuries. And however, during the learning process, I gradually found myself very interested in this profession. Also, by coincidence, I started to get into weight training and discovered that physical therapy knowledge can be combined very well with weight training and other sports. So at the time, I also saw a physical therapist from United States, Jeff Cavalier, who had worked as a team physical therapist in Major League Baseball team, and later opened a gym and filmed a lot of weight training or physical therapy related knowledge videos. So later I was just still a student and really learned a lot from his videos, not just knowledge, also for how he promote the physical therapist to public. From then on, I decided to create my own fan page, and after graduation, and film some education video for everyone in my spare time. And also at that time, I wanted to become the physiotherapist to help more and more people prevent it from the musculoskeletal pain. Yeah, so that's how I get interested in physiotherapy.
Oh, I mean, there's quite a lot there. So to dive back through that somewhat, you sort of headed into physical therapy, physiotherapy, and at the same time, you also got more sort of involved in looking at performance. So it wasn't just about sort of typical musculoskeletal health and management of pain, but also there was gym training, there was strength training alongside that as well.
Yeah.
And that inspired you to sort of start putting your own content together.
Yes.
Once sort of graduating. So obviously that was a very positive influence on you. And I know you've sort of maintained that, not just delivering physiotherapy, but also very much exercise as well. So when you went through the university course to become a physio, was there a focus on using exercise and assessing movement, or was it more the case it was manual therapy?
We focus on the exercise and manual therapy. And I graduated from the Yangming University. And
Yes.
yeah, and a lot of professors and Yangming provide us a wide range of unique courses and opportunity for internship and practical experience. Some of the professors are the member of the Taiwan Physical Therapy Association, so they will integrate some new treatment system to our courses. So in university, I have opportunity to learn like kinetic control theory at that time. So the main treatment or the main movement assessment is, I think, is the motor assessment and use the motor control to treat people's problem.
All right, so you're introduced into that at university, so that's quite rare. Often when we talk to physical therapists coming through education, it's not they're not usually exposed to that during their undergraduate. So that was quite unique then, and certainly knowing the team there at that particular university, that makes sense. Okay, when you then moved into employment, what was your first physical therapy role?
Well, after graduating, I working at a clinic near my home. The clinic's business was mostly focused on national health insurance treatment. In Taiwan, the physical therapy covered by health insurance, typically only includes low-level treatment like HAPEC, traction, or electrotherapy, those modality treatment. And if a patient wants one-on-one physical therapy for evaluation, manual, or exercise, it's all self-payment. But fortunately, the doctor at this clinic actually supports the content of the physical therapy. So he referred quite a lot of patients who were willing to receive manual therapy or exercise. So in addition to provide those modality treatment at the clinic, I had many one-on-one patients, and that's my first job after my graduation.
So with being exposed to movement assessment and movement retraining at university, did you then have a chance to use that in that clinic?
Oh, yes. A lot of people who came to our clinic for a sports injury, so I have a lot of chance to assess their motor control, their kinetic trend, to find out the key point of the key problem of their movement.
When were you then first exposed to a kinetic control course? So rather than it being part of the university course, when did you first see KC being delivered as a course?
I think it was in my sophomore, I think. She just told us about the movement health and the way a kinetic control see a muscle, like a muscle classification model, and how we train the muscle, like inner range holding. Yeah, that's my first time to exposed to kinetic control.
So having been exposed to it in university, then when did you first go to a kinetic control course? So taught in Taiwan?
I think it is 2016, I remember. Since after graduating, I went to fulfill my mandatory military service. And during the service, I actually had a lot of free time. So I used my free time to plan for my post-service development, and such as what course I wanted to take, include kinetic control and create a fan page. So after I graduated from the school and fulfilled the service, I think just 1 or 2 months later, I take the first kinetic control course with Suzanne.
So 2016. So I mean, yeah, we're looking at a good 6 or 7 years now. And then when did you think about getting involved in teaching?
2020, I remember. And actually, the process of how I got involved in teaching kinetic control and movement science practitioner was quite unexpected. I had the opportunity to participate the interview and successfully join the team through the Suzanne's invitation.
Yeah.
But at the beginning, Suzanne didn't know me, but one of her classmates who had switched to marketing from physiotherapy wanted to collaborate with me for my because of my fan page, and she asked if Suzanne knew me. And Suzanne then remember that I had taken her kinetic control courses and answered her questions very often in the class. So and also at that time, MSP was preparing and need instructors to teach, and also CMS would like to expand the kinetic control course to more places in Asia. So Suzanne asked if I was interested in being an instructor. So after the interview, I was honored to be accepted into the team and started by training instructor.
And then tell us about your sort of your first teaching experience then. So you first got involved in the teaching.
My first teaching experience was in last year. I think is in November. And the first course I teach is muscle synergies, neck and shoulder.
Talk to me a little bit about movement science practitioner, because I know that's also really relevant for what you do, because you obviously got this sort of interest in strength training and see the benefits of that. So what can you tell me about movement science practitioner?
Well, I think movement science practitioner is is good for the coaches or Pilates trainers since through the MSP, these professions can know more about how we uh, classify the muscles into global stabilizer and global mobilizer. With this classification model, they can they can carry that what how the movement looks like for more to become more efficient.
And just again, from your perspective, working in Taiwan and delivering courses there, as well as sort of seeing patients within a clinical sort of space, what do you sort of see as maybe the big changes within movement or movement assessment over the next sort of 5 years? What do you think? What do you think is going to change?
Perhaps, I think because the research standards and measurements method make it difficult to statistically analyze this value other than muscle strength. So related studies are more difficult to present. But with the development of technology, I believe that advances in motion measurements, such as high-speed photography or wearable detection devices, can provide us with more accurate recommendation and an indicator in motion assessment. So perhaps in next 5 years, there will be more user-friendly products that can help us to detect patients, clients' movements in a clinical setting. So I believe motor control will be a mainstream in the maybe 5 year to 10 years in Taiwan.
Yeah,
And
I think that's that. I think that's a nice sort of appraisal really of where we're at. Is there are maybe certain things that are easier to analyze, easier to investigate, such as muscle strength and aspects of strength, compared to some of the subtleties we see within maybe the KC model associated to things such as motor control. And maybe the technology isn't quite there yet to inform on these things. But as you say, these developments in terms of wearables and also maybe sort of markerless technology might start to reveal things with sufficient sample sizes when we can sort of identify what we think we see within sort of clinical scenarios or when we use the sort of CMS principles. So we will see. But yeah, that's I think that's where we're at. So I think that's a good appraisal of where things are going and also the current limitations of this compared to other measures such as strength. Yeah. Okay. So for somebody who'd never seen kinetic control or who was unaware of movement health, what would you say? Why would they be maybe why should they check this out? Why should they have a look at kinetic control or movement health?
Yeah, sure. I think this question can be broken down to several concepts. First, I think that case theories is very important for patient education. I always tell clients that they need to maintain activity after the injury in order to recover faster. And the key is their uncontrolled movement. They just need to avoid it. And we when we able to control and prevent the uncontrolled movement, then the body tissue will have chance to rest and recover. So I think first the case theory is more important in patient education. And second, in terms of treatment, I think Kinetic Control will give us a complete framework and standard motor control test. We can determine which testing movement to use for evaluating uncontrolled movement by looking at the direction of the patient's hand and the relatively flexible area. And through the uncontrolled movement, we can further identify the dysfunction is due to local stabilizer, global stabilizer, or global mobilizer. And after that, we can also determine whether the restriction is from articular or myofascial sources. So just follow this framework, our assessment and treatment are more focused. We can clearly identify which movement is out of control and how to address the problem. So I think this is really good and easy for the physiotherapists to manage people's problems. Just follow our framework and follow our standard test.
Okay, so within that, then we've got education for the patient. I guess there's also education for the clinician, but also then there's that framework to help the clinician with that patient and to identify where those particular issues are in terms of that loss of movement choice. So absolutely okay. So that very much sits in within the CMS framework and Kinetic Control. All right. Well, Hunter, I will say thank you very much for your time in terms of our chat today, and I'll catch you on that next course.